quickly, I'm Editor-in-Chief of Intervention, which is the journal of mental health and psychosocial support in conflict-affected settings. We're a scientific journal with a peer review process, publishing twice a year. The heart of our work as a journal of 20 years standing has been in seeking to share knowledge and the experience of MHPSS practitioners, researchers, policymakers, and others in an inclusive and accessible way for the benefit of those impacted by armed conflict and other emergency settings. So we're therefore really pleased to have this opportunity of working with United for Global Mental Health in facilitating this webinar, particularly since our next issue, which is due out on May the 9th, features a special section on the climate crisis and MHPSS. I don't think I need convince you that climate change is the greatest health threat facing the world in the 21st century. As our editorial explains on this topic and indicates, the evidence suggests that exposure to more frequent and intense extreme weather events and the chronic and slower onset impacts of climate change has very detrimental impacts on mental health and psychosocial well-being, both on individuals and communities. And unfortunately, this climate change exposure and effects are not distributed equally, with low and middle income country settings being the most vulnerable to health hazards, despite having contributed least to the global climate crisis through their CO2 emissions per capita. So many of those already facing adverse social and economic conditions that increase risk of poor mental health in the world are also most affected by the climate crisis. Researchers and practitioners are increasingly seeking to understand what can be learned from what we already know in terms of MHPSS and for future responses in the context of the climate crisis, and also in seeking to establish key new areas and in seeking key research priorities to take our work forward. So we'll be looking at this. We'll be hearing more about this as our conversation unfolds today in a few minutes. I'm very pleased to be joined by an excellent panel of 4 people with expertise and experience in this area. Before I invite them to introduce themselves, I just want to explain the format of this webinar. We're going to have a round of preset questions, first of all. The first few will be setting the scene, I suppose, and then the next few exploring the topic in more detail. And then we'll take questions and comments from you, the audience. So please feel free to be using the chat function to send us your questions, your comments on this topic. We'll be taking them in a wee while. And as we draw to a close, we'll share some key takeaways just as we finish on the hour. So I'm pleased to welcome you, and I would like to invite our panel to introduce themselves before we get going. Thank you. Lennart.
Thanks very much, Wendy, and hi everyone. Glad to be here as part of this panel. I'm a senior research fellow at the University of Melbourne at the Centre for Mental Health, where I work in the areas of suicide prevention, population mental health, and disaster risk reduction. Traditionally disaster researcher, but branching out to understand the broader context of it all. And I might leave it at that for now.
Hi everyone, it's an honor to be here today speaking with you and with this panel. My name is Brandon Gray. I am a technical officer in the mental health unit in the Department of Mental Health and Substance Use at the World Health Organization headquarters in Geneva, and also a co-chair of a working group within the Interagency Standing Committee Reference Group on Mental Health and Psychosocial Support in Emergencies that focuses on disaster risk reduction and the climate crisis. And I will stop there. Thank you and nice to be with you.
Hello, everyone. Such a pleasure to be here with you today, and thanks very much for the invitation. I'm Yura Augustinavichus. I'm an assistant professor at the McGill School of Population and Global Health based in Montreal. And I'm also the lead of the Climate Change and MHPSS portfolio at the MHPSS Collaborative, hosted by Save the Children Denmark, where we host a research working group focused on MHPSS and the climate and ecological crises. I'll stop there.
Hi, everyone. It's an honor to be here. Thank you for the opportunity. My name is Jessica Novia. I'm a youth representative from Yakum, a safeguarding climate focal point and a project lead in Yakum Emergency Unit, Indonesia. I'm working on the community-led innovation partnership project, which is focusing to overcome barriers, increase effectiveness, and encourage involvement of people with disabilities, elderly, and people most at risk in climate change adaptation, disaster management, and risk reduction. Thank you very much. Over to you, Wendy.
Thanks very much, everybody. We're delighted to have you here and grateful. I want to give a shout out to Lennart and Jura for being guest editors for our special section, and also to Brandon for his support of the development of the special section that we'll be publishing later in a couple of weeks' time. So if you're ready, panelists, I'd like to begin our round of questions, the preset questions. And turning first to Lennart, what are the impacts of climate change on mental health and well-being?
Thanks, Wendy, for the question. And not a small question at all, I might add. We could fill books and hours of discussion about this topic, obviously, but I might try a quick 3-minute synopsis of this, and we can always go into more depth later. And I guess sort of, as many of you will know, current projections sort of by the IPCC indicate that the future, or our future, is marked by rising global temperatures, more frequent and intense climatic events such as cyclones, floods, droughts, and wildfires, but also longer-term environmental changes such as sea level rise and land aridification, and all of which can have significant direct and indirect impacts on societies, livelihoods, as well as broader health and mental well-being. And by way of background, we also know that mental health issues obviously account for a large share of the global health burden, and there's a global existing gap in appropriate access to mental health support. And on top of this, we can then regard climate change as an amplifier of existing mental health risks, insofar that climate hazards will likely affect larger segments of the global population in future. And this includes those, as Wendy mentioned, who are often considered more vulnerable or marginalized, such as the elderly, young people, First Nations people, or those with existing mental health issues. In addition, climate change hazards can also undermine the very foundations of good mental health through direct and indirect impacts in different pathways, and also interrupt existing avenues for mental health and psychosocial support. And the existing wider literature on the topic of climate change indicates that climate change will have a range of acute, subacute, and broader impacts on mental health and well-being, and through various pathways. Among these impacts, it's probably the acute impacts that have received most attention in the past. And we know from decades of disaster research that disasters can have the potential to trigger new, but also exacerbate existing mental health issues. And while a majority of the people affected will typically be resilient and may only experience some transitory stress response, a significant minority will nevertheless go on to develop more severe mental health problems, such as PTSD, depression, and anxiety disorders. And far from being just a short-lived phenomenon, I think the longer-term duration of both these disaster-related stresses and the associated mental health outcomes has also recently become more clear. On the other hand, increases in ambient temperature have been associated with increased psychiatric hospital admissions, as well as increased morbidity and mortality, also particularly among those with existing mental health issues or taking psychotropic medication and whose thermoregulation may be affected. Increased heat and humidity have also been associated with elevated rates of suicidality. Broader psychological and existential reactions, which can emerge in response to anticipated or unfolding climate crisis impacts, have also increasingly gained attention. And these include phenomena such as climate anxiety, which are particularly evident among sort of the youth and younger generations, but not just those, and other groups as well as ecological grief and solastalgia. But that's still very much an emerging area. However, it's also important to recognize then when faced with such climate change impacts, humans also embrace active hope and are frequently galvanized into action to engage in altruistic and pro-environmental behaviors to prevent and address climate change. So as you can see from this quick first whirlwind overview, it's a vast topic, and there's a lot more to be said about that. And I believe that we also have some perhaps review resources to share in the chat with you in a middle while. So I might leave it at that for now, but we can always go into more depth.
Yeah, thank you very much, Leonard. Thanks. I'd like to turn to Brandon now and ask a question about the context of this, and particularly in relation to WHO. Why is mental health important in the context of climate change, and why was WHO interested to support the intervention special section on this topic?
Thanks, Wendy, and thanks for the question. I think Leonard has actually just described very well why this is an important topic for us, because of the way climate change and mental health sort of interrelate or intersect. I'm glad you asked him the question of how the impacts play out, and not me. He covered it very well, but I think those impacts are what really is driving our motivation. Right? We know climate change is leading to more and more natural hazards and other forms of emergencies, which have direct and indirect impacts on people's mental health. And we know the climate crisis also affects many social and environmental factors that can determine people's mental health. Things like health status, housing, occupation, income, air quality, water quality and quantity, food security, all of these things, right? And climate change impacts those factors in a very negative way, unfortunately. And so we know that there are pathways to increasing the global burden of mental health problems because of climate change. And this is an issue that we think is important because, as many attendees to this webinar series will already know, mental health is itself already a massive global issue, sort of taken apart from the climate crisis, right? There are nearly 1 billion people we know living with mental health conditions worldwide. $1 trillion is lost every year just to two of those conditions, depression and anxiety. COVID-19 has led to a massive increase in the prevalence of mental health conditions. And so climate change is only going to make all of those figures that are already major problems worse. And so we find it very important to address this intersection because of what is to come. I think because of the climate crisis, which just continues to grow with global inaction. I think on the flip side of that, when we think about trying to address this problem, which you said very, very well is perhaps the foremost threat of the century, when people have good mental health and well-being, they're more likely to be resilient, and they're more able to participate and engage in what is meaningful. And we hope that more and more that's climate change mitigation and adaptation to address this crisis itself. So when it comes to the special section in the intervention journal and why we thought it was important to support this, I think the section, the examples that are given there, the evidence that's built can go a long way to continue to raise awareness for this need and to recognize mental health as something that's important as a cross-cutting issue within climate action, but also to broadly raise awareness for the fact that the climate crisis is continuing, it's growing, and it's something we need to do something about now. Thank you.
Thank you very much, Brendan. Sobering stuff. Drew, I'd like to turn to you now and to ask you about attention to research. The impact of the climate change on mental health continues to receive less research attention. Could you tell us why you think this is and what needs to be done to move this issue further up the agenda?
Thanks, Wendy. Yeah. Well, I think it's an important question, and just to kind of highlight the issue a little bit, It's now been more than a decade since the Lancet Commission on Climate Change and Health called climate change the biggest health threat of the 21st century, and that's quite an important statement. And despite this widespread recognition of how climate change impacts health, mental health has not been well represented in the climate change and health space or literature. In fact, only recently was a mental health indicator actually added to the Lancet Countdown for Climate Change and Health, which is an annual report that tracks health and climate change progress across indicators. So in the 2020 report, for example, among 43 indicators that were used, none focused on mental health. And this was actually identified by the authors of the report as a clear and important gap. Luckily, in the 2021 report, so last year, there was a mental well-being indicator included. So indicator 1.15 focuses on heat and sentiment. And for anyone interested in taking a look at that, the citation is in Romanello and colleagues in 2021. And this indicator essentially aims to assess the influence of extreme heat on sentiments with Twitter data to capture people's online expressions. So without going into a discussion of the indicator, I just want to emphasize that this is kind of the first tracking of mental health and well-being globally, which is quite important. And the relative lack of inclusion and focus on mental health in the context of climate change is seriously concerning to date. Because as my colleagues have indicated, we know that mental disorders are a leading burden of disease and they contribute significantly to mortality globally. And there are also important implications in terms of the social and environmental determinants of mental health and well-being, as Brandon just mentioned. And we know also that climate change is already adversely impacting mental health and well-being and will continue for generations to adversely impact mental health and well-being. And so what are some of the reasons that this might be happening, that there's this relative lack of attention on the impacts of climate change on mental health, at least compared to other health issues? Well, I think that part of the reason likely has to do with the inherent complexity of what we're talking about. So of actually assessing, addressing mental health and well-being. That's been a challenge inside and outside of the climate change and mental health space. And with climate change, we also have an additional challenge of actually linking mental health and well-being constructs to this very complex multi-level issue of climate change. And so there's a lot of methodological complexity in that. So in capturing and analyzing essentially climate change and mental health data, and frankly, a lack of available data as well, specifically on mental health, for example, globally, that can be linked to climate change. Other reasons for the relative lack of prioritization of mental health and well-being within the climate and health and overall climate change agenda are likely similar to those that explain why mental health has lagged behind as a priority overall. And luckily, we're seeing that changing gradually. But it's required a lot of effort in recent decades to bring mental health and well-being, mental health and psychosocial support to the table. And so things like stigma, for example, associated with mental health conditions, the ability or inability to situate and link mental health to complex problems globally, the inclusion of mental health and well-being in policy statements and guidance, and of course, global competition for funding and other resources. And so all of these things are at play as we're trying to push this forward. And so despite this sort of lower level of attention paid to climate change and mental health issues overall, I do want to emphasize that research in this area is rapidly growing, and that's quite a blessing. So in a 2021 scoping review that was published by Fiona Charleston and colleagues, and I think that might be in the chat now, they identified an 8-fold increase in the number of studies on climate change and mental health that were published in 2007 versus 2020. So that's a massive change in just over a decade. And most of this research, more than 3/4, has actually been carried out in high-income countries. And this really represents a significant gap, and it highlights inequities that are really predominating this arena. So essentially that climate change and mental health research is not being done in the context and by people who are most impacted by climate change. And that's a massive, massive issue that we must all work to address. Some of the things that I think can help us continue to move climate change and mental health up the research agenda include increasing advocacy efforts for the inclusion of mental health in climate change and health and climate change adaptation and mitigation research policies and practices, improving how we conceptualize, measure, and develop methods for assessing climate change and mental health impacts and interventions so that we keep growing this evidence base in the literature. And it's important, as I said, that people living in areas that are most impacted by climate change have an opportunity to lead, design, and fairly participate in this research. And that's currently something that's not happening. Funders have a really important role here, as to date, there's been very little funding allocated to climate change and mental health research overall because of, political reasons and other reasons. And so that really needs to change. And we also need to ensure that mental health and well-being are included as part of national climate change and health monitoring and as part of programmatic monitoring and evaluation, not just of mental health and well-being programming, but also climate change adaptation and mitigation and other humanitarian and development programs. And finally, I think it's important that we continue to find ways to work outside of our traditional silos. Climate change and its impacts are extremely large in scope and complex, and no one sector is going to be able to tackle this alone. So we really have to move outside of our comfort zones, integrate our efforts, and work together.
Thank you very much, Jura. Thank you. And now if I come to you, Jessica, how is YACM especially approaching the issue of the climate crisis and mental health and psychosocial support, and what are some of your priorities there?
Yes, thank you, Wendy. As Leonard mentioned also earlier, that the climate change is closely related and affects the level of disaster threat that will happen, which is believed to increase risk of the hydrometeorological disasters. Climate change also accounts for up to 80% of disasters events in Indonesia, and then the series of the disasters was not dominated by the hydrometeorological events such as floods, extreme weather, drought, water shortage, and landslides. And these very events are affecting people's lives, which can cause them post-traumatic stress disorder, anxiety, depression, stress, and those who experience disasters might cause difficulties in their social interaction. They are also losing their self-confidence, and this could also lead to high potential for sexual and gender-based violence. During the disasters or in the event of the failed crops due to drought by the farmers, it also causes unstable economic conditions and highly affects their mental health. One of our communities, for example, they are living in the area which is prone to flooding. If it rains heavily for more than 2 hours, people there will always be worrying that the water will rise, and especially at night, which makes the community there unable to sleep. Because it happens so often now, they have also given up on their electronic goods being damaged since their economic condition cannot support them to afford new ones. This is also affecting their situation of their living. So within YACUM and YACUM Emergency Unit, we prioritize mental health approaches in climate change adaptation and our DRR interventions, and link them within our program designs by involving the communities within our project, also with the community-led partnership. And we are also doing ecological approach, such as psychosocial support. So when responding to climate-related disasters, we also provide psychosocial support by reactivating community activities that have been maybe in hiatus because of certain events, such as like women gathering activities in the village, and then the spiritual activities where we also collaborate with other faith-based organizations. Communities here are relying on their spiritual beliefs, and it could help them to be more calm. Also, when they are together, it makes them feel less lonely, and it could lift up their spirits to recover and feel back better.
Thanks very much, Jessica. I'd like to turn back to Leonard now. In my introduction, I talked about learning from applying existing MHPSS approaches, what can we learn from them in terms of our future response to the climate crisis? Leonard, if you'd comment on that, thank you.
Yeah, thanks, Wendy. And I think sort of as Jessica just demonstrated, really, I think there's sort of a lot that's already happening in this space and that works at a local level that is culturally appropriate and so on and so forth. But perhaps more broadly speaking, I think sort of the good news is that when we look at the impacts of climate change, there's actually a fair few things already in place. We've got MHPSS frameworks, we've got approaches and interventions that have actually already been applied in complex humanitarian emergencies and also in varied climate sensitive disasters. So that's, as a starting point, is not so bad, really. Perhaps there's no acute need to reinvent the wheel or start entirely from scratch here, because there's a fair bit of learning that's already happened over the last decades in this space from these interventions, from these approaches, from these policies and systems that we can definitely take forward and scrutinize and learn from, which is a good starting point. And interestingly, as you alluded to earlier, I think this is also the path that several of our contributors to the upcoming special section of intervention have actually taken, to probe and examine sort of those very sort of existing approaches that we have in place, to see and probe their merit. What are their existing strengths and limitations in view of the anticipated impacts of climate change? I guess sort of more broadly speaking, adding to that, sort of the evidence base for the effectiveness of interventions is gradually amassing as well, even though there are perhaps also still gaps in terms of some of the psychosocial interventions, in terms of their effectiveness, such as psychological first aid, as we know, which is still more largely consensus-based and evidence-informed. It probably does no harm, but we still don't know whether it actually works. And there are other gaps as well. But it's also worth noting that hardly any of our existing interventions in this space have been specifically developed for climate change or with climate change in view. And I think one of the articles in that special section also points that out. So I think there's definitely further room to scrutinize what it is that we're doing, our roles within this space, our interventions and their merit for what we're trying to solve here. And it might be that some of these interventions might have no relevance at all to some of the issues that climate change is bringing about, and others may well. So some of that might be business as usual, others may not. Where the difference lies has to be scrutinized. So I think there's definitely room for further scrutiny, development, and also customization of existing interventions here.
Thanks very much, Leonard. And just a reminder to our audience, please be posting questions and comments in the chat box, and we'll look at those in a wee while. Jura, can I turn to you in terms of future research priorities? How do you see that in terms of mental health and the climate crisis? And can I just ask panelists to be fairly brief, because we're already running a little bit late. Thank you.
Sure, I'll try to keep it short, Wendy. Thanks for the question. So I've been fortunate enough to participate in 2 efforts to identify research priorities on climate change and mental health. The first was a study led also by Fiona Charleson in 2022. Perhaps, David, you could put that one in the chat as well. And that study identified global priorities for climate change and mental health research. So really taking a very high level view and asking experts working in this area internationally to sort of contribute to the generation of priorities. And they identified 10 priorities in this study for advancing climate change and mental health research. And I encourage everyone to take a look at the paper to actually look through all of those priorities. But just to give you a little bit of a flavor, they range from understanding mental health outcomes impacted by climate change related exposures that impact mental health, understanding factors that increase vulnerability and resilience to the mental health impacts of climate change, appropriately measuring climate change related mental health impacts, and defining and quantifying causal pathways between climate change exposures and mental health outcomes, as well as many others. So do take a look at the paper to review the full list of the 10. I also recently led a Delphi study, which was supported by the MHPSS Collaborative, again, hosted by Save the Children Denmark. And this study was focused on priorities for mental health and psychosocial support intervention research specifically in the context of the climate crisis. And this study is going to be published in the upcoming Intervention Journal special issue. So we're quite excited to share that with you. And as I mentioned earlier, the MHPSS Collaborative hosts a working group on MHPSS and climate and ecological crisis research. And the study was really born out of a recognition within this group that there was a lack of understanding of research priorities on mental health and psychosocial support in the context of the climate crisis, but specifically from the perspectives of those who are working actively with MHPSS interventions and living and working in climate crisis affected areas. So a bit of a different frame and different sample from the Charleston study. So we wanted to respond to two questions. First, how should we define the parameters and terminology related to the field of MHPSS and climate crisis research? And second, what are the most pressing research questions or data evidence needs to support action on MHPSS in the context of the climate crisis? So again, when the study is published, I encourage you to take a look. But I'll just say that this study, I think, adds to the one by Charleston and colleagues by focusing specifically on intervention research and by recruiting a sample that was predominantly made up of professionals working in the area of humanitarian and or development-oriented practice. And out of the research priorities that we identified, there were sort of three core areas that need to be assessed or addressed in the future, I should say. The first is assessing population needs and how climate change intersects with mental health and well-being. And so that one is a little bit similar to the priorities identified in the Charleston paper. The second is understanding how to design, adapt, and implement MHPSS interventions in the context of the climate crisis. So that gets to what Leonard was just talking about now. And the third is really focused around how best to evaluate MHPSS and climate crisis focused interventions, including the selection and measurement of indicators and outcomes. And so within each of those, there are specific priorities that you can take a look at within the paper. And I just want to highlight a couple of other things that we learned through this study.
I don't think, sorry to interrupt, I don't think there is enough time at this
Sure.
point. Sorry to cut you
No
off.
problem, Wendy.
But
Yeah.
I recommend people looking at your paper. Thank you. Sorry about that. We have 3 remaining questions, which I'd like to give time for. Back to Leonard, what would you say are the key challenges of the climate crisis for mental health and psychosocial support?
Thanks, Wendy. I think there are various, and Jura just raised some really, really important research-related points, I think, that are deserving so much more attention as well. What I'd like to highlight is just a few thoughts, and one of those relates to the need to review the merit and limitations of our existing arsenal of MHPSS approaches in view of the existing climate change impacts. And I believe there's some mapping work already underway by very diverse colleagues, some of whom are on this call, to look exactly at that, to see what we have in place, what we don't have in place, how that matches up against the types of outcomes that we anticipate to see in the future and how they might impact on populations. I believe that we might also be facing an MHPSS capacity issue quite likely in view of the increased demand that climate change will drive, even though that's up for debate. And while that should help to make the need for MHPSS more evident in future, which is something that we're always struggling with in terms of promoting mental health amongst other health issues and more severe death-related things, it also highlights the importance of upscaling and capacity building in the future, I think. I think for us within the field, it's quite important to reflect on the traditional role that we have in this field, where we quite often come in, at least in humanitarian fields, after something's gone wrong, to mop up and help people get better. But one could argue that MHPSS doesn't actually necessarily prevent climate change or disasters, but rather seeks to ameliorate the negative consequences. Or do we? And as such, our field could be well viewed by some as a growth sector, or perhaps even a potential climate change beneficiary, which is quite interesting, perhaps slightly provocative to consider. However, I think there's only so much satisfaction to be gained from that personally, and it rather signals to me the need for urgent, more preventative approaches, including effective engagement of broader community and cross-sectoral stakeholders, and also effective climate action, which is not always part of what MHPSS does. So the integration of those worlds. I think another challenge is the increasing complex world that we live in. Disaster cycles are barely simple anymore these days, or unfold on their own and uninterrupted, but often multiple overlapping sort of exposure contexts that we're dealing with. And so we need to look at beyond specific events to broader drivers and also systemic impacts. So I think I might leave it at that in the interest of time. They've got other things to mention, but that's it, Wendy. Over to you.
Thanks very much. Well, the next question is to Jessica, and it's really about being on the ground. What should impacted individuals and civil society organisations be doing to engage others in the issue of the climate crisis and mental health?
Yes, thank you, Wendy. As you mentioned, we mostly work at the inclusive local level, so it's important to reach out and make it easily understood in a local context with a local wisdom. Communities, they really understand what's happening to them, but it's in their own ways. Probably they wouldn't use the terms climate change adaptation for what they are doing, but they are already performing it, they're already implementing it in their area. And it is necessary to use everyday language to adjust to what they understand, and then to use examples that are easy for them to get the meaning. And it's also important to see the cultural background and then provide an enabling environment where everyone can speak up comfortably. For the CSOs, we also need to reach out, and it is important to be able to consolidate together to promote the advocacy, so then we can cooperate with the government and other institutions. In here, we call it as a pentahelix approach, where the multi-stakeholders, elements of the governments, academics, private sectors, NGOs, communities, faith-based organizations, and the media working together to reach the positive advocacy in the changing, and engaging local communities and encouraging them to develop local ideas in order to reduce the impact of the climate change. When people can do something such as climate change adaptation in their area, during the shelter in the emergency condition, they are doing the organic farming or sorting waste, it's actually very good for the mental health, because they can contribute their local action, and then they're doing it together with the community. So it's bringing a positive environment for them. I think that's from me. Thank you.
Thank you very much, Jessica. And final question to Brandon about governments. So climate change is increasingly impacting people worldwide, including the mental health. What can governments do to take action?
Thanks, Wendy. I think to take action, first we need more organizations like Jessica's and people like Jessica working at a local level to address these problems. But generally, I think when it comes to governments and to all of us, we need to recognize the impacts of climate change on anything, whether we're talking about physical health, mental health, the physical environment, and to start addressing those impacts and preventing those impacts, as Leonard has said. So we need to scale up climate action in a lot of ways, and mental health needs to be part of that. I think generally also a great way to address the mental health impacts of climate change is to build effective and comprehensive community-based mental health systems. And this is something we need to do generally already, and it's something that's not being done. We know, for example, from WHO's most recent mental health atlas in 2020, that still only 25% of countries, 1 in 4, are reporting having the functional integration of mental health at the primary care level. That's just simply not enough. And as we've discussed already today, as mental health problems increase due to the climate crisis, there will be more of a need. So countries also need to invest in mental health. Financially, we know this is a figure you've all already heard, but only 2% of health expenditures by governments on average is on mental health. And that number has been very low, and the same for a very long time. And in low and middle income countries where the impacts of climate change are unfortunately going to be much worse, that figure is even lower. So there needs to be much more investment financially, but also in human resources. We know on average there are about 13 mental health workers per every 100,000 globally. But in low and middle income countries, it's closer to 1. So there just aren't enough resources to address the problem. I think we also need to do better at preparing for climate-related emergencies and engaging in disaster risk reduction and increasing the integration of mental health within that. We know already here that this is something countries are recognizing, and this is a strong statement from the World Health Assembly in 2021. But still, figures aren't great there. Only 28% of WHO member states report having a functional program for mental health and psychosocial support preparedness for emergencies. So that number needs to increase as well. And then lastly, I would say something that's maybe obvious, but I think it's very true. And that's that we all, including all of our governments, need to take action to address the climate crisis itself. Right? We're talking about the way it impacts mental health, the way it impacts health, the way it impacts anything, but really what needs to be done is to take action to massively scale up climate change mitigation, to stop environmental degradation here and now, to do our parts to reduce greenhouse gas emissions, and on and on. But we need to really address the crisis itself in order to reduce the impacts it will have on all other aspects of life. And I'll stop there, but thank you very much.
Well, thanks very much, everyone, for that round of questions. There are questions and comments coming from the audience, and we have about 5-10 minutes at most to look at these questions. I'd like to start with this one, which maybe is sort of a policy-related question. It says a slightly different angle in the context of mental health advocacy, but I wonder, given the links between connection and engagement with the natural world and good mental health, is there an argument to add protection of mental health as an additional reason as to why climate and biodiversity action must be urgently increased, i.e., in addition to the focus on mental health impacts of climate change implications, extreme weather events, etc.? I wonder if one of you might have a comment on that. Any comments or response? Yes, Jura? Yeah. Yes.
I'm happy to jump in, Wendy. So I'll just say, I don't think that from the research side that there's a lot to kind of support this particular kind of pathway. So in other words, kind of how mental health contributes to action or engagement in climate change, although that area and biodiversity work, for example, although that area of research is certainly growing, and I know that there's a lot of interest in it. I will say my own perspective is that I think that there really is something here, and that, you know, if we were able to make this argument a little bit better, then we'd be able to mobilize resources, policy supports, et cetera, both for mental health in the context of climate change, but also for some of the action that Brandon was saying is urgently needed. And so certainly I think that mental health and well-being could be treated as sort of an argument or reason for advancing that. And we also heard as well earlier from our colleague that actually participating in these types of responses and preparedness efforts can positively contribute to mental health. So Jessica highlighted how at the community level, that's quite helpful. And there is evidence from the disaster mental health literature of that in the aftermath of disasters. So so certainly something really important and something that we need to be working on.
Thanks very much, Shura. There's a question from Eamon Hansen. He says, or they say, climate change is very slow, e.g. 1.52 to 2 degrees temperature increase by 2023. How do we explain that we can already see an impact in PTSD and anxiety, depression, and confirm the effect is not due to confounding factors?
I'm happy to take that question, Wendy, if you like.
Yeah, thank you.
And thanks, Eamon. I think you're raising some really important points there, which relate to attribution and causality really in this space, and also diverging timescales. Climate change happens in decadal timeframes, if not longer term timeframes. Mental health issues happen sometimes fairly quickly. Other times also take years. So there's a bit of a divergence between those timescales. It's always a challenge for research. But more broadly speaking, I think what you're raising here is an issue about the challenges of attributing sort of mental health impacts to climate change. And within the disaster space, it's a tiny bit easier. You've got events there. So you can attribute, as the IPCC report says, sort of the increasing frequency and intensity of disaster climate-related events to climate change and rising temperatures. That's fairly well established. In my view, personally, it will never be the science of individual specific events, but it's the signs of more than one event for sure. On the other hand, then you have the attribution question related from the event to the mental health impacts. And I think there we have fairly good evidence already in place from decades of disaster research, robust designs, sometimes more, sometimes less robust, that can speak to that. But I think it's a really important thing that we have to be quite clear about, that while we'd like to be able to say it's humans who bring about climate change, it's those events that result from it, and it's those mental health impacts that result from that yet again, it's often a lot more complex than that. So I think so we're not rushing into sort of causal attribution here. And it's people like Chris Ebi and colleagues, I think, who've looked at detection attribution methods in this space, which I'm not yet fully across, but I believe there are 2 papers out there on these methods. And to my knowledge, there are no attempts so far to apply these to mental health. So I think even if you're a researcher, please make sure you read those papers and apply those to mental health, because we need this research in the space. Modeling, looking into the future too, is a good way to go about this.
Thanks, Leonard. Maybe a couple more questions. One, I think perhaps I'd like to ask Brandon to address this one. In terms of health system strengthening, what do you consider is the most pressing challenge in terms of mental health and climate change?
Thanks, Wendy. And I think this is the key question, and it probably will bring me back to saying something I say all the time, and you've heard many people say all the time, and you've maybe said yourself all the time, depending on who asked the question. But I think the key challenge, the key barrier to mental health system strengthening is resources, and that comes from lack of priority, right? Lack of maybe interest, lack of awareness, stigma, a number of factors, but I think ultimately at the end of the day, it comes down to the fact that we don't invest enough in mental health in terms of financial investment, but also in human resource investment. And so in many countries, there just simply aren't the systems in place to provide mental health services to people in need who are living with mental health conditions, but to also address and sort of ameliorate or prevent those social determinants that can lead to mental health problems. All of which, as we've said, are made worse by climate change. So again, I would say we really need to massively scale up our investment and attention to mental health systems, services, but also prevention when it comes to how climate change relates to mental health.
Thanks, Brandon. And Jessica, excuse me, Jessica, I wonder if you would add comments about what that looks like in your context in Indonesia in terms of health system strengthening.
Yes, thank you, Wendy, for the question. We are working also together with the approaches together with the government and then the multi-stakeholders. So this can also give like the prevention and also the education for the people so that they understand what it is. As Brandon mentioned, I fully agree with the resources. And we are also advocating for the resources to be available in the community level, so it can be sustainably funded to the community. So the communities are the ones who manage the fundings, and then they also be able to reach. So not only through the big organizations, so it must be on the ground level also. I think that's from me. Thank you.
Okay, thank you. And a final quick question, if I can squeeze this in. How can young researchers participate in this type of work? Jura, do you have a couple of encouragements here?
Yes, well, please get in touch. First of all, it's a small community, and I think folks who are working in climate crisis and MHPSS work would be excited to partner with young researchers. And also, take your ideas and try to get just a little bit of funding if you can to kick them off and do them. I think that's really important. And if there are ways that we can support through our positions, then, like I said, get in touch. I think that's the most important thing. Yeah.
Okay, thank you. I'm sorry we've not had time to look at all of the questions, but I hope this has been useful. I want to close with a round of key takeaways from our panelists. Can you give us a tweet length answer to the question, how can we effectively prevent the adverse impact of climate change on mental health? Okay, Leonard, you're off.
Thanks, Woody. Look, I'm not on Twitter, so I'm not familiar with the format, but I'll try. This is pre-formulated. I think an important pathway for averting future mental health impacts of climate change within our field is to mainstream climate change mitigation action and adaptation planning in our agencies, in our frameworks, and our approaches for mental health and psychosocial support.
Okay, thank you. Brandon, over to you.
Thanks, Wendy. I hope what I say is not reflective of my lack of Twitter capacity, but what I would say is we only have one planet and it is at risk, and each one of us must find a way in any way to take care of the Earth. It's not a scientific discussion or an academic debate, but it's really our existential responsibility.
Thank you. Jura.
Yeah, similarly, so not familiar with the Twitter format and haven't been on Twitter in a long time, but mine is by supporting climate change adaptation and mitigation efforts as mental health advocates, and by integrating mental health and well-being supports with climate change adaptation, mitigation programs and policies, and other programs and policies that are designed to address the social determinants of mental health.
Thank you. And Jessica.
I will keep it short too, but I think I need to explain it with the explanation. So I think have a conversation and bring the subject up at the local level and give the access of the information to people so then they have the knowledge of what to do, how to do, where to go, how to ask for help. I think that's it. Thank you.
Thank you. Thank you. Well, that's just about it. I think we'll draw the webinar to a close now. I want to thank you for your participation, engagement. Thanks to the panelists. And I want to let you know that next month's webinar will be on the 17th of May, and it will be on the global emergency response with a specific focus on Ukraine and other global conflicts and crises. And just also a reminder that Intervention will be publishing its issue with a special section on the climate crisis and MHPSS, and would recommend that to you too. So thank you very much for your engagement and for your interest in this topic, and best wishes with your work and with what you're doing today. Thank you.